Official Opposition Spokesman, Shadow Minister Greg Stafford.
It's a pleasure to serve under your chairmanship, Sir John, and I congratulate the Honourable Member for Stroud on securing this important debate and his characteristically well-informed speech, and impassioned indeed, and his knowledge as a GP brings a real benefit to this chamber. Also want to congratulate the Honourable Member for Lowestoft on her appointment as the Government's advisor on violence against women and girls and her excellent and impassioned speech, and I'm sure the ideas that she has will be a great benefit to the Department and to the Government as a whole. This, Sir John, is a necessary debate, but it is also an uncomfortable one. The figures before us do not describe a system merely under strain. They describe a system that is failing, unfortunately, too many women and children. And if we're serious about change, we must be honest about responsibility and delivery. I want to thank the Honourable Member for Stourbridge for her experience and that she brought to the speech, and alongside the Honourable Member for Leeds Central and Headingley, their discussions on honour-based violence, which I think is very prescient for today. Also want to thank the Honourable Member for Bolton North East for her experiences, and I think we were all very interested to hear more about the Irish system that she mentioned in her constituency. And as ever, the Honourable Member for Strangford bringing us a Northern Ireland perspective on this is welcome. And you, Sir John, despite the fact you haven't spoken in this debate, I think it is worth noting your campaign on Holly's Law, which is for a mandatory register of abuse against domestic animals, because so often abuse of animals is a precursor or is alongside abuse of humans. So thank you for the work that you do in that. And likewise, as honourable members have said, abuse happens across this country, and there is none of us who are untouched by it. In my Farnham and Borden constituency, I think of the horrendous case of Alan Jermy, who stabbed his partner, Kirsty Wilson, to death, set her alight as their two small children were asleep upstairs. It's cases like that that I think bring it home to all of us. Now, the Minister will know that the NHS has more contact with victims and perpetrators of domestic abuse than any other public service, and that puts it in a unique position to intervene early, but it obviously also brings a responsibility to deliver. Now, the Department has set out ambitious plans around alcohol harm, neighbourhood health services and better access to support, and those ambitions are welcome, but ambition needs to be judged against the outcomes, and unfortunately nationally there is a growing gap between ministerial intent, which is welcome, and the frontline reality. The Office for National Statistics show that 6% of women aged 16 and over were victims of domestic abuse, and likewise police last year recorded more than 1.35 million domestic abuse-related crimes and incidents. The consequences are often fatal. There were 108 domestic homicides that year, 83 of whom were women. For adult female homicide victims, 6 in 10 deaths were the result of domestic homicide, almost all at the hands of a male partner or ex-partner. Domestic abuse is also a significant driver of suicides, we've heard. Between 2020 and 2024, 98 suspected suicides followed domestic abuse, including children. This is not marginal, it's systemic. So the government's freedom from violence and abuse strategy is welcome, but its impact is undermined by persistent failures in delivery. Training remains inconsistent, referral pathways are unclear, staff lack time and the capacity to act. And the evidence is clear. As mentioned by the Honourable Member for Richmond Park, in June 2025, Standing Together Against Domestic Abuse reviewed domestic abuse-related deaths and found that 89% in 2024 contained at least one recommendation for healthcare professionals or the wider health system. Time and time again, as the Honourable Member for Stroud mentioned, opportunities for intervention within the NHS were missed. Yet, at precisely the moment when this learning must be embedded, the government is reorganising the NHS, abolishing NHS England and cutting integrated care board budgets. Standing Together has warned that these changes risk weakening domestic abuse and sexual violence protection work at local level, including in training, coordination and follow-through. A system that is restructured, distracted and under financial pressure cannot deliver the prevention that we all want. So in Surrey, police receive around 19 domestic abuse calls every day. Domestic abuse is now more prevalent than shoplifting. These are systemic failures playing out in real time in our communities. I want to briefly speak about a young woman who lived in my constituency. Sky Nichols, who was killed in 2023 at the age of just 22 after nearly 2 years of coercive control and abuse by her ex-partner. I've spoken with her family and friends who were campaigning for mandatory psychological assessments following a police report of domestic abuse. One told me that too often the focus remains on visible injuries, while psychological abuse is underestimated or dismissed, even though its effects often last far longer than physical harm. For families and friends, mental health support is frequently fragmented or absent, despite them often being the first to spot the warning signs. Prevention does not begin at the point of crisis, it begins with early, trauma-informed intervention. Now, NICE guidance clearly sets out how NHS staff should respond to domestic abuse, but guidance alone doesn't save lives. Women's Aid's 2025 report found that just over half of referrals into community-based domestic abuse services were rejected, nearly a quarter because services couldn't even contact the victim. When support is reduced to just phone lines and signposting, unfortunately women fall through the cracks. So detection is really important, and often accident and emergency is where the physical signs of this abuse is seen. But as the Honourable Member for Stroud mentioned, primary care is often the first point of contact, and we must use GPs and other primary care services expertise and give them the time to effectively identify, intervene and support those victims. But the NHS cannot act alone, Sir John. The justice system must also command public confidence. That is why the early release scheme for serious offenders, including rapists and murderers, is so damaging. It sends entirely the wrong signal to victims and undermines trust in the institutions meant to protect them. And we as the Conservatives will continue to oppose this policy. Under the previous Conservative government, we introduced a statutory definition of domestic abuse through the Domestic Abuse Act 2021, recognised children as victims in their own right, and published violence against women and girls strategies, and invested significantly in victim services, mental health and suicide prevention. But we are honest enough to say that legislation alone is not enough. The Domestic Abuse Commissioner has shown that only 6% of police-recorded domestic abuse cases result in a conviction, and only 1 in 5 victims feels confident reporting abuse. That demands competence and delivery, not the constant structural upheaval that we're going to see both in the justice and in the health systems. We made good strides in this area, and I do genuinely believe the ministers in the department currently are doing their level best to move forward. However, I think we all agree there is so much to do, and where the government is making those strides, we, as the Conservatives, will support them full-throatedly. So I close with 3 questions to the Minister. First, the government has I welcome the government's announcement of a 5% funding uplift, but given rising costs and national insurance increases, how much of this is a real terms increase, and how much will go directly to the front-line services for victims? Secondly, when will mandatory safeguarding and domestic abuse training for all NHS staff formally begin? What will rollout look like? And when will the entire workforce have completed it? And finally, what assessment has the department made of the case for mandatory psychological assessments following a police report of domestic abuse to ensure victims receive early trauma-informed support? Sir John, you do not prevent violence against women by just abolishing institutions, cutting local capacity and releasing dangerous men early. You prevent it by enforcing the law, backing the front line and putting victims, not the systems, first.